Deep tissue laser therapy is having a profound impact on how clinicians are rehabilitating patients. In an era of advanced techniques, laser therapy is one of the fastest growing treatment approaches when faced with some of the most challenging musculoskeletal and physiological cases. Dr. Kevin Wilk of Champions Physical Therapy in Birmingham is a leading authority on rehabilitation of sports injuries and post-surgical recovery. His contributions as a clinician, researcher, and educator have been significant. He shares his experience with deep tissue laser therapy and speaks about the future promise of this new, exciting treatment approach.
I've started using laser therapy probably about 14, 15 years ago with some pretty primitive type units. I think we had to treat patients quite a bit, a lot of treatments for patients to notice some type of benefit. Then kind of the evolution of the laser therapy devices improved, I think, in the last 4 or 5 years, going to more of the deep tissue laser therapy units. We believe that deep tissue laser therapy, the dosage is very, very important. And I think more and more studies are proving that the higher the dose, the more energy that you get per square area in the tissue, the better effects you get, both from a cellular standpoint, but also from a metabolic standpoint as well. At our center here, we're pretty aggressive. So we get you moving right away. We want to expedite your recovery. We don't believe in immobilization. I think our outcomes have significantly improved since using deep tissue laser therapy. I think we get a better result sooner, meaning that patients feel better faster. I think they like it, so they come in more often and they ask for it. Deep tissue laser therapy we use just about in every one of our patients. I was thinking about it, this week alone, and I was trying to remember a patient I didn't do it on. We use it everything from bone to ligaments to tendon to muscle to disc, and even nerve root irritation for that matter. We had a great effect on iliac bone bruises in football players, called hip pointers, where people weren't able to walk, and after about 4 or 5 treatments, they're walking and getting back to practice and playing. And if we were going to skip something, like sometimes patients come in and say, well, I only have 40 minutes, or I only have 20 minutes, 30 minutes, we have to cut out some things. The deep tissue laser therapy is not one of them. The LightForce EX allows us great flexibility in the clinic with the multiple attachments. So it gives us the specificity of treatment really with the deep tissue laser therapy to treat that particular patient and their unique characteristics, but their unique lesion or pathology that's going on. What deep tissue laser therapy allows us to do is not only treat the pathology, but also again treat at the cellular level. So, for a diseased tendon that's degenerative, we're looking for collagen laydown, we're looking for collagen synthesis. We're trying to affect it at the cellular level to create this cascade of a healing effect. We think very strongly that deep tissue laser therapy is allowing this to occur, and it's actually facilitating it, more so than just exercise alone. LightCure Medical has been great to work with. I'm very impressed with their approach to things. I think the support is excellent. There are studies coming out on a regular basis proving the efficacy of deep tissue laser therapy, and I think it's just a matter of time before it's a modality, if you will, or treatment approach that's used by everyone.
For more information about LightForce deep tissue therapy lasers, call or visit us online today. Get your patients back in action faster with LightForce therapy lasers.